Thank you for joining the National Telehealth Webinar Series. My name is Janine Gracie and I'm Project Director of the Heartland Telehealth Resource Center. We serve Kansas, Missouri, and Oklahoma. On behalf of all of the regional TRCs, welcome to our monthly webinar. The Heartland Telehealth Resource Center is extremely excited to host this month's webinar that will provide you excellent information regarding the 411 of telehealth funding. But before I introduce this month's expert, I would like to provide information concerning our telehealth resource centers. This map shows our presence across the nation. There are 12 regional telehealth resource centers, so please take a minute and find your regional TRC. It is also important to note that there are two national centers, one that focuses on policy at the Center for Connected Health Policy in sunny Sacramento, California, and one that focuses on technology at the Telehealth Technology Assessment Resource Center, which we all know as TTAC, out of Anchorage, Alaska. The Telehealth Resource Centers are funded through the U.S. Department of Health and Human Services, Health Resources and Services Administration, or HRSA, at the Office for the Advancement of Telehealth, which is part of the Office of Rural Health Policy. Telehealth Resource Centers in some shape or form have been around for over 10 years and were established to provide assistance, education, and information to organizations and individuals actively providing or interested in providing medical care at a distance. Our mission is to expand availability of healthcare to underserved populations, and because we are federally funded, the assistance that we provide is generally free of charge. So logistics for today's webinar. Number one, you will notice that you are all muted, so no worries there. Number two, if you have content questions for our speakers, please use our Q&A feature at the bottom middle of the screen. Just type in your question and we'll do our best to answer those questions at the end. And do not, if we do not get to all of those questions, we will certainly follow up with you. And number three, if you have technical difficulties today, please call 317-517-3961. Again, 317-517-3961. All right, this month, the Heartland Telehealth Resource Center presents the 411 of telehealth funding. Our national expert is Dr. Eve-Lynn Nelson of the University of Kansas Medical Center, and she is the director for the Center for Telemedicine and Telehealth, as well as a professor for the medical center. Dr. Nelson brings a strong track record of federal and foundation funding related to evaluation and implementation of telemedicine projects. Her research is focused on the evaluation of evidence-supported, patient-centered approaches in underserved communities. Through her leadership with the federally funded Heartland Telehealth Resource Center, she frequently speaks and consults nationally about telebehavioral health practices, including interventions that use technologies to promote healthy lifestyles. She was recently asked to serve on the National Quality Forum and will focus on the effectiveness of telehealth intervention in rural areas and the challenges faced by rural health care communities. You are in for a real treat. So Dr. Nelson, you can take it away.
Thank you, Janine. Give me just a second here to pull up the presentation. Great, well, welcome everyone. I think we're excited to have everyone on the call in the new year. I just wanted to start off the presentation by sharing kind of the tagline for our original talk was the 411 on telehealth grant funding, lessons learned the hard way. So I think what we're hoping to share is one program's experience and just some of the lessons, times we've been successful, but as much times we've not been successful, and learned some things from that. I'm really respectful that lots of folks on this call are experienced grant writers. They've done a lot of amazing things with grants. So I hope we can hear from our colleagues throughout the presentation as well, because what I bring is, again, just that R1 program's experience, and hopeful in sharing some of the lessons learned, it might help in others not having the same challenge. I want to start off with some disclosures and appreciation. First off, I don't have anything to disclose, but I would like to thank a lot of folks that provided input on our presentation, especially from the TRC world. And I'm also appreciative of our funders, and as we reference some of our projects, just am grateful for some of the opportunities that our funders have provided us over time. Where we want to start off, and again, this is a lesson I hear from my Telehealth Resource Center colleagues many times, is just with any kind of funding, including grant funding, which is the focus of today's presentations, is really just establishing your team's telehealth vision first. So really thinking through what's your expertise, where do you want to make an impact. Our Missouri colleagues on a call yesterday really reminding us that with the funding landscape as it is, where we're all kind of faced with challenges sometimes as our state funding has changed or our other funding has changed, there's a lot of draw to follow the money with grants. And I think there's a lot of opportunities, but really going back to the basics and thinking, will that funding help meet a crucial part of your team's overall vision, and really putting efforts toward a grant or other funding opportunity that's really going to fit that overall vision. I know our telehealth resource centers have a lot of expertise in looking at how can a program assess their vision, how can they get down to those details, and really thinking about, do you have champion readiness, organizational readiness, and community readiness, where the grant funding is going to fit and help advance your individual program's vision. In terms of purpose and looking at telehealth grant funding, really thinking about, is your purpose to advance your business planning, both for short or long-term sustainability, or more is the purpose research, where it's really not just to look at your own program, but then to also inform other programs about, will this approach work? And really thinking about, with research, it's often more a time-limited approach, where more the programmatic business planning or a QI project may have a longer-term scope. And then also, just as you think about all these things, making sure you think about all that your telehealth resource centers may offer. I know with our own Heartland Telehealth Resource Center, for example, we do an eStart readiness assessment that really informs what's the grant planning, but then what's the broader planning needs. With that, you're also thinking about, well, what's the reason for your grant funding? What's your motivation to look at the particular grant? And really thinking about what piece of the overall vision that the grant may help you achieve. I think, again, this is my own lesson learned the hard way. Sometimes I've tried to follow the windmill and look for that grant that's going to address the whole vision, and that's unlikely. It's more a small piece of the pie and working toward that vision over time. So again, trying to fit the funding within just one piece of that vision. Thinking about your own team's readiness. So that kind of a rule of thumb is, boy, if you got that grant tomorrow, would you be able to move forward? Do you have all the other pieces that, if that piece comes through, you can run with it? And then in addition to grant funds, in addition to the funding part, really thinking about how the grant might benefit in other ways. Sometimes the writing of the grant or hopefully receiving the grant really helps your team gel. It may help you talk through some of that overall vision. So even if you don't receive the funding, the process of the application may have some extra benefits. And then as you look at receiving the funding, above just having the opportunity to move forward with your aims, there's also extra benefits that your funder may open extra doors. And then thinking about being part of that cohort of investigators who have received funding, it's really a great chance to network. So sometimes even if it's a small grant, if it has these extra opportunities of beginning work with a funder or looking at who else you may have the chance to work with, sometimes that helps you make some decisions about whether you decide to move forward with the grant application. As you then think about some of the grant funding, thinking about, well, what is your scope with the particular grant funding? Is it more a team and network development grant, more a planning grant? Are you more looking at some questions around the technology itself or a new intervention, looking at reliability, usability, or feasibility? And with that, again, you may be thinking about performance improvement designs, or you may be thinking about research designs. With some of those early research too, you may be thinking about trying something in a controlled environment. For example, with some of our telehealth interventions, we piloted them here first at the Med Center before then we rolled them out to the rural environment. So just kind of thinking about where is the intervention at in terms of development and evidence, and would something smaller then make sense for a broader rollout? Or you may be looking at more efficacy effectiveness trial, with those really looking at often some larger funding opportunities, as you may be thinking about multi-site trials and those sorts of things. Or more are you interested in the dissemination and implementation component and looking at grant opportunities that really focus in on, you know, which sites and why, who was able to do certain things and why, and some of those dissemination and implementation designs. Or are you more interested in a training design? Is the purpose of your grant application really more to look at how do we train up the next generation of healthcare professionals around telehealth? How do we support our existing healthcare providers and professionals in implementing telehealth in their setting? So I hope what you take from this slide is there's lots of opportunities. It's just thinking about which piece of the pie and what makes the most sense with your particular grant funding opportunity. I think, again, this is just a reminder for myself, is do make sure you're thinking about the science first. I think, you know, I've been wowed by some of the technology sometimes, and sometimes that's, that has led, but the most successful applications we've had is where it is that technology wow factor, but then that's really paired with our best science, and making sure the folks on your team reflect both of those components, folks who really know the technology ins and outs, and then folks who really know whatever science methodology that you're looking at, whether it be qualitative or quantitative or other designs. And then as you're thinking about your science first, just really, there's no perfect design. There's always strengths and weaknesses with every proposal and every science approach. So just trying to be transparent and acknowledge those strengths and weaknesses. If it really makes sense that it's a first step ahead of a non-randomized randomized trial, just being transparent about where your team's at in the process, or where the science is at in the process, and then even reflecting that long-term vision that this is a non-randomized pilot, but it's going to give us great information for our long-term goal for a randomized trial, if that's what you're looking towards. I'd like to give just an overview of some types of funding that we pursued. Again, this is not an exhaustive list. Others on the call may chime in with other great ideas of where grant funding exists. This is just, again, to try to help generate some ideas. So first we'll talk about types of funding. Towards the end of the presentation, we'll talk a little bit more about proposal ins and outs and some lessons we've learned on that side too. So jumping right in, as you consider potential funders, you may want to think about considering, is your particular angle and approach more around the healthcare condition and disease? or is it going to be more around a health, wellness, and prevention approach? So, for example, we just had a multiple sclerosis proposal go forward that was really more condition-driven. Some of the other proposals have been across conditions where it was more looking at geographic, urban versus rural. We've had other proposals that have more focused on really families and sites that have low resources. So some proposals may focus on the poverty or some of the geographic site-specific concerns. Some proposals may focus in more on serving particular populations based on ethnicity, age, military service. Others may focus on different types of telehealth interventions. Is the focus more inpatient and outpatient, or more a pairing of the two? And then with some funders, they may really be excited about medical home or a particular type of service site. So some of our proposals have focused more on primary care, and some have focused on schools. So a lot of times with your big vision, there's things that could fit in all of these buckets. So thinking about each of these different type of funders may help you advance a particular component of your proposal. There's, of course, technology and broadband funding. So if your vision really, there's needs for some of the technology side of things, really thinking about what opportunities there are to help with that. This is just a few of the different types of funding. Things you might keep in mind as you look at this type of funding is really balancing how much may support the technology itself, how much may support the personnel, and each grant has its own mix of that. So just kind of thinking through those components. I want to make sure we talk about internal funding. Sometimes internal funding is pretty small. But sometimes it really has good bang for your buck. It's really helped us sometimes get that early feasibility data that's then helped us move on to larger funding opportunities. So just thinking creatively even about what kind of institutional or other internal funding that might be available. We have had some from departments, some from our research institute, our Children's Miracle Network had some opportunities for internal funding. And then sometimes it's special calls are related to internal funding. I mentioned the MacArthur interprofessional funding because that ended up being a really good fit for us. It wasn't a call for technology, but so much what we do with technology cuts across professions that internal funding ended up being a really good fit. So sometimes thinking a little outside the box about how interprofessional or other unique opportunities, you might tilt your approach just enough to be a good fit for that. We've also had more internal disease-specific funding, for example, through our Midwest Cancer Alliance, which is the outreach arm of our cancer center. And then really maybe exploring whether your region or institution has a clinical translation science award. Sometimes the CTSA programs, they support some pilot funding around academic community partnerships. And for some projects, that might be another avenue. Another area to keep in mind with grant funding is professional organization funding. So again, sometimes this may be initially a smaller amount of funding, but sometimes it can open the door for within that professional organization further or larger funding opportunities as they get to know your program and see the results. Or it may just help with that initial information that helps you apply to other organizations. So for example, we've been funded through the American Academy of Pediatrics around a pediatric epilepsy echo. And for us, that was really crucial funding. It of course helped us advance some of the pediatric epilepsy content, but it really helped us develop our echo team. So we're really appreciative of that initial funding from a professional organization that's helped us pursue not just a pediatric epilepsy echo, but other echoes. Another small funding that we had was through the International Lactation Consultant Association. And that, again, it was a small funding, but it really, it had a lot of bang for its buck with helping us apply for other projects. For example, that piece was helpful in us later receiving NIH funding around our mom health approach, which is a tablet-based approach to help pregnant and parenting teens in the home-based setting. And then some other foundation support, looking at what you may have locally available. For us in our area, some of more the service-related grants and funders locally have been helpful, both from our local REACH Foundation and also our Healthcare Foundation of Greater Kansas City. I think with those, we really have had to think carefully about how will it meet the needs of underserved, and how will what we're doing really be able to be applied from a service standpoint, in addition to more the research side. On a regional standpoint, some of the foundations like the Aetna Foundation, those can be helpful. And then on the national level as well, the Robert Wood Johnson Foundation, CX2 is another one that's been very pro-technology. For example, CX2 is a focus on looking at educational approaches, but they've also been interested in the technology part. So that's been really helpful in the advancing echo. I'll circle back to the Robert Wood Johnson Foundation. I think that's another good one where it was just a small piece of what we wanted to do, where it was really looking at measured development. So that foundation interest in that area then helped us develop something that was used in later projects. There's a ton of alphabet soup with federal funding. So we're just going to talk a little bit about some of the funders that we've been fortunate to work with. Again, I hope others add to this list. I'll talk here in a minute about HRSA funding, talk a little bit about SAMHSA funding and NIH funding. We've not been funded by the National Science Foundation, but they do have a lot of great opportunities. I mentioned one, the Smart and Connected Health is a really good example of some NSF funding related to telehealth. The CDC also has opportunities, and then I will mention our funding in just a minute. So as you're thinking about, wow, which of these agencies might be a fit for what I want to do, really looking at the mission statements of the particular agency, that can be helpful just to let you know, wow, may it be a fit, but then also repeating some of that mission statement language back in your proposals sometimes can be a good thing, just to really reflect to the funder that you're on the same page and that what you want to do is a good fit for their overall mission. I really encourage reviewing the particular funding organization's documents that speak to technology. Also, they may have documents that speak to access, health equity, or related telehealth concepts, and even referencing some of those documents sometimes in proposals. You may want to think about telehealth, as well as some agencies or organizations may talk about more health information technologies, but telehealth may be within that umbrella. And then I think our own group has really often referenced the quadruple aim in a lot of our applications, and a lot of times that that is overlapping the mission of the particular agency. So thinking, of course, about patient experience, improving population health, reducing costs, and then with Bodenheimer's group adding in improving the work life of healthcare providers across not just the providers, but their overall staff. Again, with some of our funding, we have looked towards HHS. This slide is just a reminder slide to help kind of think through, wow, are any of these a stone unturned or a place that you might think about looking for possible funding. With us, we've often reached out and utilized some opportunities to apply for HRSA funding. I think likely folks have thought about some of the Office for the Advancement of Telehealth and some of those funding opportunities, but there's other groups within HRSA that may also be potential funding opportunities. So, for example, we've had some grant funds out of Maternal and Child Health Bureau. Sometimes those have been specific calls that mention telehealth within the application itself. Of course, the Telehealth Resource Centers have the Office for the Advancement of Telehealth funding. And then also, you may want to think about some of the training opportunities, funding opportunities offered out of HRSA, out of the Bureau of Health Professions. And then, as I mentioned before, there's also training opportunities out of the Maternal Child Health Bureau. I think with some of those, the telehealth has been a piece. For example, with that last one, the leadership in education and neurodevelopmental and related disabilities, it's a larger proposal, but adding in the telehealth piece was really a win-win, where it made our application unique, and it really went to a lot of the goals for access that the overall application was looking at. Sometimes, of course, there are specific calls for proposals, so really being on the lookout for those calls that may be asking specifically for telehealth. For example, one of our funding came through SAMHSA, where they were really looking at ways health information technologies could expand access. So that really helped with some of our school-based and advancing some of our school-based telehealth. The same with some recent Office for the Advancement of Telehealth funding. They had a special call related to school-based health centers. So looking at that special call then to help, again, advance some of our broader interest in school-based telehealth. As you're looking at NIH, it can just be dizzying. There's so many different opportunities and institutes. So really looking at, and with NIH, it seems like you've seen one institute, you've seen one institute. So really trying to look in detail about that particular institute's mission, looking at what they may have funded in the past from a telehealth standpoint. And there may not just be one agency that's a fit. There may be several agencies. And as you do your homework and kind of narrow it down to a couple, then really reaching out to that NIH program officer and chatting with them about what's their advice, if what you want to do may be a fit for their institute's mission and some of their priority areas. With NIH, of course, you're wanting to think, is it an RFA, which is more a one-time opportunity, or is it more a PA, a program announcement, where it's going to be a recurrent opportunity for the 3 submission opportunities a year? Thinking about with NIH what particular funding mechanism you may be most interested in. On the research side, you know, you may be starting more on the small RO3 side and really getting your foot in the door, and then building more through the R21, R34, and then finally looking at the larger RO1. Or is more interest your interest career development, so looking at their K awards? Or are there other mechanisms that may be a more fit for what you want to do? You may want to think about the particular institute. Different institutes in NIH, of course, have different amounts of funding. So really thinking through for what you're proposing, is one or more of the institutes better funded, where you might have a greater chance? Thinking about what's that institute's pay line, and looking at does that influence your decision on where you may think about applying? And then this is one that I wasn't as good at early on, was talking to the program officer at NIH. But I think they really do want to chat and really talk with you ahead of time to see, does your concept fit? And they really offer a wealth of information about other resources or other institutes or other documents from their particular institute that may be relevant to what you want to do. As you think about NIH, we already talked a little bit about, of course, looking at the wow factor, but pairing that with the best science. You may be thinking about pairing your telehealth with other new theories or new models. So, for example, with our R21, it was really pairing the technology part or the telehealth part with more a theory around multiple health behavior change. So kind of, I think it was the 1-2 punch with that, where it was a couple of areas of innovation that kind of helped advance that. So you may just want to weigh those things about, does your methodology or does your design have innovation as well as the technology innovation? We've really tried to build programmatically with some of our NIH funding, and just kind of, that of course takes thinking long term and really talking to your whole team and talking with other colleagues. For example, we with Dr. Smith's team just completed an R01 that looked at home-based mobile technology for more adults. And then with our more recent R01, it even narrowed down to teens. So trying to take what we learned from the adults and then looking at a different population and trying to build that programmatically. And then, again, others on the call may have been successful with moving from a K or a training award more to an R01. Dr. Davis is a good example from our KU Med Center, who kind of did that on a telehealth side, where it was her career advancement around rural children with obesity and using telemedicine, and then rolling that into a larger submission. With NIH-focused resources, you may want to think about participating in some NIH-sponsored events. Often these are lower cost, or sometimes there's no cost. They have a lot of neat webinars that folks can participate in. The Office for the Office of Behavioral and Social Sciences has a really good series that they offer that often has technology-related presentations. There's different training institutes that the NIH offers that I think if you're bringing telehealth interest, sometimes those training institutes can be a really good fit. Often those are a competitive process where the investigator is providing a summary of what they'd like to do, and then the institute then gives them the mentoring and the peer support to move forward. A particular interest of this group may be the mHealth Training Institute. They have their previous trainings. Those materials are online, so some of that information may be of interest. There's also technical assistance events at larger conferences that NIH offers, and sometimes that can help, even as we were talking before, think through, well, what institute may be the best fit. And so if you're at a larger conference that has those kind of NIH technical assistance events, sometimes they're really good to attend and get to know people and put names with faces and those kinds of things. And then NIH also has some team science resources that I think can be valuable as you're looking towards telehealth grant submissions, so I included that link as well. I'm, of course, not going to go through all the, I know you likely can't see all the details of this slide. This is kind of looking at SAMHSA and some of the SAMHSA funding. I guess my point in putting this one up is that with SAMHSA, it was kind of a lesson learned that there's a side of the house that focuses on assessment and a side that focuses on treatment. And so kind of thinking through which side of the house is a best fit for your particular interest, more assessment or more treatment. But I think overall, it's just kind of, as you're thinking about a grant, you may want to pull the organizational chart or pull the structure so you really think about, well, which side or which particular place within that larger organization is my proposal the best fit. Same with ARC and looking at the ARC funding. I think that ARC is, they funded a lot of technology-related projects in the past. It seems they have especially some interest in health information technology and some of the EHR things. So thinking about does your telehealth intervention also impact the larger, broader health information technology, and thinking about in a proposal how you might potentially include both. ARC also was early in funding ECHO and ECHO models, so I think that they have some interest in that area. So just really thinking, does it impact primary care and some of the healthcare sites? Then it might be an idea for ARC. And then, of course, there's larger funding opportunities. There's PCORI funding. They have some standing calls at PCORI with their national priorities, and then they also have special calls. And then CMS Innovations is another opportunity. I don't believe that CMS Innovation has a current call open, but it's always good to look at their Innovation Center and see what kinds of opportunities may be out there as well. One thing with both PCORI and then other agencies is you may want to think about reviewing for the organization. I think reviewing, it gives you a real feel for what is the criteria for funding, and not just as how's that look on paper, but how does it work in practice. So if you have a chance to review, sometimes it can be time consuming, but sometimes it really can help you get good ideas for your own submissions. And by that, I don't mean looking at other people's ideas. I more mean just what's the structure, what kinds of things are they looking for. And then, of course, there's also industry grant funding, really looking at, it may be how is it a win-win both for the particular investigator and then also for the industry funder. I gave an example from our own group where our own institution where in an app development, for example, it was something really the app developer was already interested in and the researcher was interested in. So kind of putting that peanut butter and chocolate together really made it a win-win. I put this slide up. It's another industry-funded example through Nokia. Dr. Bonnie Spring spoke here at the institution in the fall, but I think not forgetting the industry opportunities. I know Dr. Spring talked about it, how it really helped recruit a large number of participants in developing countries. I think this study had over 1,900 participants, so it's just another thing to keep on your radar when you're looking at grant funding. In terms of looking for opportunities, thinking about the listserv through grants.gov, thinking about individual granting agencies may have their own listservs. For example, PCORI has a listserv. Thinking about your interest-specific list, through NRHA or other groups, through NIH institutes, or through your particular professional interest. For example, I'm on the Social Work Research Network, and they have a lot of really good opportunities that especially look at access. So each different profession in your world may have their own listserv that helps you keep on the radar for different grants. And then with grant opportunities, of course, we are thinking of the long haul. We'll talk about this in just a minute as well. Really thinking about, is it a recurring opportunity where, you know, it may be helpful to submit what you have with your best foot forward, and then understanding that it may then be a step in the process where you get your first review and that feedback, where then you're looking towards resubmitting. So that's kind of an overview of some different funders that we've worked with and some things that we keep in mind. I'm going to shift gears now a little bit and talk about, just as a new call comes out, what some lessons that you might keep in mind. Before we shift gears, Janine and Becky, were there any questions that you saw that came up more around funders before we go on to this next part?
Yeah, there was one question on NIH. Let's see, let me go back to this. I work for a community-based organization that uses telehealth, and we are interested in pursuing NIH funding to expand services and assess the effectiveness of our services. How would you recommend that we connect with a researcher to apply for funding?
That's a great question. So one thing you might think about is if you have any of the CTSAs, the clinical translational research groups, sometimes they can really be a good matchmaker between the scientist and the community organization. Another way you may look is if there's some leaders in the field where they've published in your area of interest, sometimes reaching out to that team, that, you know, they may not be the one in your region that's the right group, but they might be able to direct you to other folks they know in your area that might be doing research in that area. I'll put a plug in. Our group is based out of the community engagement group in our medical center. So I think looking to see if there may be a community engagement group or an outreach group. Some of those groups may on the campus may be able to help kind of connect the dots between who may be a fit for your interest area.
Thank you. And then we didn't talk about this earlier. Are you willing to share your slides?
Yes, sure.
Okay.
Yes. And I appreciate that question. I know some of these slides are dense, so I am glad to share them. It was more to generate ideas than necessarily, you know, look at every agency title. So I appreciate folks' patience in that. I hope it's a discussion starter rather than feeling like you have to see every small print on the slide. So thank you. I'm glad to share them.
All right, that's all we have for now.
Super. Well, it's grant season, so I think we're many of us are waiting for new calls to come out and getting out the readers so we can look at the fine print. I think, of course, you do always want to read through and reread through the proposal many times. You know, get your highlighter out and think through kind of what are the pros and cons. I think that's hard to do, again, where you're sometimes feeling really pressed to look at funding. So getting not just your own ideas, but sharing it with some colleagues and really thinking through, with the efforts that a grant takes, really thinking through, is that, do the pros outweigh the cons? And also it helps, we always have our business folks reading the fine print early on too, to help us make sure we're also thinking through all the budget development and those kinds of things early on. Again, this is just a lesson learned the hard way, where you want to avoid the idea. I think this means, you know, really reaching out. If you're not sure, asking the program officer early on, because you don't want to get at the end of the submission and find out you weren't even eligible, or those kinds of things. When it's possible, when they do a conference call or explanatory session, it's good to listen in on those. They're often archived, so oftentimes those kinds of conference calls you can listen in after the fact. And then do read the question and answer sections. Sometimes for some grants that's more crucial than others. In some applications, I think this is especially true on foundation applications, things can change based on what is said in the Q&A sections. So really trying to check those throughout the process that you're planning to submit. And then this goes back to our first slide, just really thinking in your mind, is it going to help you advance an important piece of your vision? Looking closely at who's eligible to apply based on what kind of entity you have. Thinking about, are there partnership opportunities where if you're not eligible, can you potentially partner with someone? For example, some grants are only for rural or only for urban. So, based on your particular organization, it might be partnering or working with a larger group. And then, is there any pre-work that is required? So, making sure there's if you must have the pre-work and it's just not a place you're at, then acknowledging that this particular call just may not be a fit for you. Sometimes there's other planning grants that may be more focused on the required pre-work. So maybe circling back and thinking, well, I may not be eligible for this call, but maybe that same organization has another call that's a better fit that would help me do the prerequisites or pre-work. Thinking about who's going to hit the submit button. Especially at universities or large organizations, really understanding who's planning to submit, who's your signing official, those sorts of things. Getting together the required documents early on. Again, I know these aren't often the hardest part of the grant, but you just don't want to be scrambling at the end. So really trying to get that checklist early on of what's going to be required. And then planning early on for the possible resubmissions as well. This one, I know, this is one I think we all kind of know, but then when you're in the heat of the moment and writing the grant, sometimes this can fall off the radar. So just keeping in mind, making it as easy as possible for the reviewer. I know I've reviewed pretty recently for an institute, and I think it was 12 applications that were all over 150 pages. So I know that's just one experience, but I think a lot of reviewers are in that same boat where just the volume of what they're asked to review now is a lot. So really thinking, how can I make this as easy as possible to read through, whether it be bulleting or how it looks on the page, just kind of thinking about that ahead of time. Thinking about, again, what kind of reviewer you may have. They may not know some of the telehealth language. They may need some general information. Sometimes a picture, if it's allowed, is worth 1,000 words to kind of help them get an idea of what the telehealth looks like. But just kind of thinking about your reviewer, it often doesn't know as many of the detailed ins and outs that you know of the particular area. Avoiding jargon, and then of course, overall good writing is appreciated. I think that takes a lot of eyes reading the application. So, when you've seen it 100 times, it's really easy to overlook some of that good writing thing. So, having and planning early on to have someone else reading your application. In terms of early considerations, with NIH, of course, with the AIMS page, you're really focusing a lot of attention and love on that very first page, an introduction to the application. And then early on, thinking about budget. I think that's one that sometimes it's hard to start thinking budget from day one, but not leaving budget till till the middle or end, but really starting thinking about that early so that it can also inform your aims, and also making sure everything is then fitting together nicely, where the aims really are going to be a fit with the budget and what you're able to do within the budgetary constraints. Thinking about contracts and subcontracts early, especially here at a large institution, that can take weeks. So really trying to think about that early on. And then we do, whenever we can, try to use the budget narrative to include some of the same repetition and persuasive language. You know, you can't, the budget narrative is not a substitution for what's in the project narrative, but I think it is a good one-two punch when you can really have those two things integrated, where the budget narrative really helps reinforce what you've said in the narrative. Another one, lesson learned the hard way. This used to be harder, where even a few years ago we were stamping the pages with a physical stamp and looking at page counts. Of course, now that's kind of switched over, and with electronic submissions, it's a little easier to keep track of some of the page limits. But those pages go so fast. 80 pages looks like a lot early on, but when things like bio sketches and those are included in the 80 pages, really just taking your spreadsheet and planning that out early can help out. And again, I know it's things we all know, but in the heat of the moment, it's easy to have those things fall through the cracks. Of course, do you build your strong project team? This is, of course, something that you're doing ahead of the grant submission, but thinking about what expertise do you already have at the table, and then who else with this specific proposal do you need to invite to the table? Sometimes people, I think, that we've approached have overwhelmingly been gracious. If they can't participate, sometimes they are willing to, I can't be on your team, but I'd be glad to read your proposal and offer advice. So I think thinking about a broad team and reaching out early, it can help you in ways, whether they're a named person on the project or if they may just offer you advice. I think also more and more thinking about who your community representatives are on the grant. If it's a patient or care-focused grant, do you have input from the patient caregiver side? Thinking about how that may also inform your team development. Do tailor to the specific application. I think as a reviewer, we do see ones come across where it's just the same application has been taken for something else and then just sent on, and that rarely is a good fit. Thinking about being creative with titles, that's not my strength, so I'm lucky to have a good team. Janine especially is really good in thinking of titles, so that one really using everybody to help think of something catchy, something that you can use throughout the content of your narrative, really to get the reviewer drawn in and excited about what you want to do. With the introduction, making a compelling case. We talked about the AIMS page, of course, being really important with NIH. And then I will circle back to the introduction. As you're making your case, really having the data and talking from your head, but then also talking from your heart and talking about really how this is going to potentially impact folks' lives and kind of the bigger vision of why this piece that you're doing is so important. And then with the narrative, of course, it's just really trying to reinforce in each section what you overall want to accomplish and bringing it back to that. In terms of tailoring, again, for the specific application, we've already talked about really bringing on the evaluation expertise as well as the technology and program management expertise. Folks can, of course, can consider internal evaluators as part of the team, or also external evaluators that folks may contract with to provide that external evaluation. Thinking about what the proposal or call for proposals may want you to provide in terms of human subjects. Often it may be documenting that if you do receive funding, what's the process and how will you go through an HSC process. And then, of course, with some projects, you may be thinking about, do you need a data safety and monitoring board if it's a clinical trial? With a work plan is a place that we tend to provide a lot of detail. I think it reassures funders that, boy, you can hit the ground running if you're funded. So really thinking through on the work plan how you can reflect that. We try to use a lot of visuals and tables in the proposal as well. Thinking early on about your letters of support. And also really kind of outlining for folks what's the best way to get those letters back. And if sending them electronically may be something that is okay with the particular proposal you're working on. And then just other things, the MOUs and MOAs, thinking about those early on, anything that requires a signature, trying to plan for that early on. And then understanding what the particular organization is going to want from a biosketch perspective. They may want the full NIH format, or they may say, I just want an abbreviated biosketch, just one page. Or some foundations, they may have their own biosketch format. So just really checking the fine print early on to understand what they want the biosketches to look like. We tend to, if we can, provide as many bios as we can, even for not just the scientific investigators, but also for some of the program management and technical folks. I think it kind of helps reflect the broad expertise of the team, but that's not always possible within page limits. And then this is just a reminder slide. I feel out of breath just talking through all these things, and I think that's how we often feel, wow, it's so much to keep in mind. So I think once you have submitted once, just remembering that helps you have many pieces ready to go for future submissions. I think for us, it's keeping in mind, not letting our successes go to our head or our failures go to our heart, because it is it's a long-term race, not a sprint. It's more the exception than the rule that you may be funded the first time. So really thinking about how the process, whether you're funded or not, has helped you get your team together and your thoughts together, that's going to make you even more competitive in the future. I think when you get your reviews too, give it a day. Oftentimes, it's hard. It's like, well, it's right there on paper. Why can the reviewers see that? And it's hard sometimes giving it a day and then going back to what the reviewer comments were, or even what their confusion may be, that may help you make your proposal better in the future. Reaching out to funded researchers for input. If someone else has been funded by the same organization, reaching out to them for advice, or even sharing your proposal, whether funded or unfunded, to see if they may have input that might help your project be competitive for the application in the future. It's hard after the grant process, giving it a couple weeks, but then circling back. And oftentimes it's a lot of great ideas that may have been generated at the time. So there might have been a conversation in there that sets up for a whole different grant application, but just really thinking through how you may continue those conversations and those relationships over time, as well as the conversations and relationships with the program officers. And then just for always keeping in mind, I think overwhelming with the telehealth world, people are really in the grant race because they really want to make a difference in the lives of the folks they're serving. So just keeping that in mind, that all the hard work is for an exceptional aim where you're really trying to figure out how the technology may help help people in your area, or it may then give knowledge that can help lots of people. So just keeping that in mind too. It's a lot of information to go through, so if you do have questions both online or after the presentation, I'd be glad to chat with you all. Janine and Becky, were there other questions that came up?
We do not have any other questions at this time, but certainly if you do have questions, now is the time. As we wait for those, I'm going to go ahead and bring up our last slides. Janine, are you ready?
I am.
Okay, hang on just a second here. Move that out of the way.
All right. Thank you, Dr. Nelson, for sharing your expertise and your time. That was very comprehensive and I believe very helpful. Next month's webinar series will be held on February 16th. TEXLA, the TRC representing Texas and Louisiana, will present Twitter, Telemedicine, Wellness, Intervention, Triage, and Referral Project. This project leverages telemedicine services in schools to intervene with junior high through high school students who are at risk for injury or harm to others or themselves in rural West Texas. So please make sure that you join us for that series. Your opinion is very important to us, and we would like to have you participate in a brief survey by clicking on the link to let us know what you thought of today's webinar and how we can continue to meet your educational needs through this series. I believe there's a question. This question says, when starting out with telehealth, is it better to go for a smaller grant or for a larger one, or does it matter?
I guess my opinion would be it'd be more fit for what you want to do than necessarily amount. I will say that some of our smaller grants have they've helped us out in the long run as much as some of our larger grants. So I wouldn't overlook a small grant if it really is an awesome fit and it helps you really do exactly what your program wants to do.
Excellent. All right.
And I have put the link in the chat to the survey, so that's there.
Wonderful. So please go to that chat and fill that survey out. I believe there might be one more question. Nope, it just said thank you. So excellent. Thanks for asking the question, and thank you, Eve-Lynn, for that response.
Thank you.
All right. So without any other questions, I think we're probably past our time. So we will just thank you for spending your valuable time with us, and we hope to see you next month, February 16th. Please go out and have a great day.
Bye. Thank you, everyone.
Thank you.